Glaucoma is a chronic eye disease that affects millions of people worldwide. It is characterized by progressive damage to the optic nerve that can lead to irreversible vision loss if not treated promptly. While there is no cure for glaucoma, several treatments are available to slow down or prevent further vision loss. Timely diagnosis and treatment are crucial in preserving the patient's eyesight and maintaining their quality of life. In this video, we will explore the different treatment options for glaucoma and their effectiveness in managing the disease. Hello and welcome to Health After 50. Stay with us to the very end of the video to catch all of the great information we have for you. Now let's get started. Eye drops to decrease eye pressure. One of the most commonly prescribed treatments for glaucoma is the use of eye drops that decrease eye pressure. These drops work by either reducing the amount of fluid produced in the eye or increasing the drainage of this fluid, thus alleviating pressure on the optic nerve. While these drops can be effective at slowing the progression of glaucoma, it is important to note that they must be used consistently as directed by a healthcare professional in order to be fully effective. In some cases, patients may experience side effects from these medications, such as stinging or burning sensations, blurred vision, or redness in the eyes. Laser surgery to improve the drainage of fluid. Laser trabeculoplasty is a surgical procedure that can be used to improve the drainage of fluid in the eyes to reduce the intraocular pressure in patients with glaucoma. This technique involves using a high-powered laser to stimulate the trabecular meshwork, the drainage system of the eye, to improve the outflow of aqueous humor. This procedure can be performed in an outpatient setting and typically takes about 10 to 15 minutes per eye. There are generally no restrictions on activities following laser trabeculoplasty, and patients may experience a reduction in intraocular pressure within a few weeks. While this procedure can be effective in reducing intraocular pressure, it may not completely eliminate the need for other glaucoma medications. Trabeculectomy to create a new drainage channel. Trabeculectomy is a surgical procedure that can be performed to create a new drainage channel for the treatment of glaucoma. This minimally invasive procedure involves making a small incision in the white part of the eye to remove a small piece of tissue around the trabecular meshwork. This creates a new drainage channel for the excess fluid in the eye to flow out, thus lowering the intraocular pressure. This procedure can be effective for those who have not responded to other treatments for glaucoma, such as medication or laser therapy. Patients should be prepared for a longer recovery time and careful monitoring post-surgery to ensure proper healing and management of any potential complications. Minimally invasive glaucoma surgery, MIGS, to reduce eye pressure. One of the primary goals of glaucoma treatment is to reduce intraocular pressure, IOP, in order to minimize further optic nerve damage. While traditional glaucoma surgeries are proven to be effective, such procedures can carry significant risks and complications. As a result, many ophthalmologists and glaucoma specialists recommend a newer and less invasive surgical approach known as minimally invasive glaucoma surgery, MIGS. MIGS involves the use of a variety of micro-invasive surgical techniques and devices to create a pathway that provides better drainage of aqueous humor, thus lowering IOP. MIGS has been shown to provide long-term IOP control with minimal risk of side effects and complications, making it an increasingly popular alternative to traditional glaucoma surgeries. Canaloplasty to enhance the eye's natural drainage system. Canaloplasty is a surgical procedure that can be used to treat open-angle glaucoma by enhancing the eye's natural drainage system. It involves the creation of a small incision in the eye to gain access to the Schlemm's canal, which is a circular channel responsible for draining aqueous fluid from the eye. A tiny catheter is inserted and threaded around the canal to open and enlarge it, which allows the fluid to drain more freely, effectively lowering intraocular pressure. Unlike other invasive surgical procedures, such as trabeculectomy, canaloplasty can reduce the pressure in the eye without causing significant damage to the surrounding tissue or nerves. It may be used as a primary treatment method, or in conjunction with other glaucoma treatments, depending on the severity and progression of the disease. Canaloplasty is generally considered a safe and effective option for patients with open-angle glaucoma who have not responded well to other treatment methods. Endoscopic cyclophotocoagulation to reduce eye pressure. Endoscopic cyclophotocoagulation, ECP, is a minimally invasive surgical procedure used to treat glaucoma by reducing intraocular pressure, IOP. It involves the use of a small, flexible endoscope to guide a laser probe to the ciliary body of the eye, where the aqueous humor is produced. The laser energy is then applied to the ciliary body, selectively destroying the cells responsible for producing the aqueous humor. This lowers the production of the fluid, which reduces the IOP. ECP is often used as an adjunct to other glaucoma treatments when medical therapies and traditional surgeries fail to control the IOP adequately. It is a safe and effective procedure that can be performed in the operating room or under local anesthesia in an outpatient setting, which makes it appealing for patients who want to avoid a more invasive surgical procedure. Monitoring eye pressure and vision regularly to determine the effectiveness of treatment. One of the critical elements to ensure the effectiveness of glaucoma treatment is to monitor eye pressure and vision regularly. Glaucoma is a challenging disease, and monitoring is a crucial component of its management. Regular monitoring is essential to establish whether the current treatment is successful in preventing vision loss or not. Eye pressure and visual field testing should be conducted as per the doctor's prescription, which may range from biannually to quarterly. Any change in the pressure or deterioration in vision requires immediate attention from the treating ophthalmologist. Therefore, it is important to attend all recommended follow-up appointments and follow the treatment plan to avoid any irreversible damage to the optic nerve caused by glaucoma. Glaucoma is a serious eye condition that can lead to permanent vision loss if left untreated. However, there are effective treatments available that can help to manage the disease and slow down its progression. From eye drops to surgeries, there are a variety of options for glaucoma treatment. It's important to work with a healthcare professional to determine the best course of action for each individual case. With proper treatment and management, people with glaucoma can continue to lead healthy and fulfilling lives while protecting their vision.